So good morning, everybody, also from my side, and welcome to this third day at the Lugano Summer School. I heard that we have listeners from all around the world, so good morning, good afternoon, good evening. Thank you for joining. My name is Marlene Heb. I'm a program officer at the Swiss Agency for Development and Cooperation, and I will guide you through this plenary session of this morning. Let me welcome and briefly introduce Professor Nino Kuenzli, who will give us an insight on air pollution and COVID-19 in this plenary. Professor Kuenzli is the Dean of the Swiss School of Public Health, which is also co-organizing this Lugano Summer School, and he's head of the Bachelor, Master, Doctorate Unit at the Department of Education and Training of the Swiss Tropical and Public Health Institute. He's a trained physician and has his research focus on environmental epidemiology. So Professor Kuenzli's research work is particularly targeting health effects and public health impact of ambient air pollution. Making scientific findings available, understandable, and relevant for policymakers is a key motivation for him, and he engages in several advisory boards to bring science to clean air policies. So welcome very much, and let me hand over to you, Professor Kuenzli.
Well, thank you very much, Marlene, for the introduction. Thank you, Suzanne, for bringing us all together. Actually, physically, I have to tell you, I am in Lugano. I have the privilege to be in this wonderful town, in a wonderful sunny day, and it is my pleasure to address a very new topic we are challenged with since a couple of months, COVID and air pollution. As a new disease with global societal impact of unprecedented dimensions, all fields of sciences got, in fact, challenged by the pandemic. So the question of the role of ambient air pollution in COVID-19 is one that came up indeed very early. The first cases were reported from Wuhan, known to be a very heavily polluted region. And thereafter, in Europe, the epidemic reached northern Italy. In Europe, this is a region also famous for its very high air pollution. So this coincidence provided the floor for all kinds of speculations. Indeed, in the earliest phase of the pandemic here in Switzerland, early March, I got an email as the chair of the Federal Commission of Air Hygiene from an activist who asked for support for a call for immediate emergency actions to reduce air pollution in Switzerland. This was nurtured exactly on the observation that northern Italy and Wuhan are heavily polluted regions. The exponential spread of the virus was assumed to be due to high levels of air pollution. So I hope at the end of my talk you will understand the various reasons why I did not support this idea at that time. Instead, the Federal Commission of Air Hygiene, which I chair, we initiated the writing of a short report for the Minister of the Environment, which is the current president of Switzerland, the Councillor Simonetta Sommaruga. So we tried to put the issues that my talk will link, air pollution with the pandemic. We like to put that a bit into perspective. We tried to distinguish between the current evidence and plausible hypotheses, although of course this is a daunting task given the fast progress in knowledge. Our report is available online in 4 languages. What we did, we identified 6 aspects that we discussed, and we lined those up along the chronology of the pandemic. So first, once there is a COVID case, the transmission is essential. So the question is the transmission, the spread from one to another person different if ambient air pollution is higher? Second, let us assume a subject was exposed to a relevant viral load due to the transmission. The question is, does air pollution matter in the way this subject may deal with this viral load? The third level, the spread of the virus, falls onto a population. Does air pollution modify the target population with regard to its encounter with the virus during a pandemic? The fourth level, among those who finally got sick from COVID, SARS virus, does air pollution have a role in the course of COVID-19 during the treatment phase? Fifth, Once people have gone through the disease, is air pollution a relevant factor in the way the long-term post-COVID-19 health conditions would develop among those patients? And sixth, my last point here, to flatten the curve during the exponential growth, some lockdown strategies had to be adopted all over the world, as you know. And therefore the question emerges, what is the impact of the lockdown itself on air quality? So this is a purely environmental science question. Of course, the 5 health points I mentioned here, they are partly interrelated, but let us separate them because the underlying causal mechanisms may be distinct. And therefore the impact on the development of the pandemic and on the potential air pollution policies, indeed, the actions, they might differ as well. I think also for research, it is useful to be very specific about the theories that we would pursue. So let me first just focus on the 6th point, this issue of the impact of the lockdown on air quality before going to the health issues. The lockdown came with a drastic reduction of the prime causes of ambient air pollution, namely combustion in industries, on the roads, in the air. So given the emissions being crucial drivers of air quality, it is very clear and predictable that the lockdown had an impact on air quality. However, in contrary to widespread beliefs, this impact is not necessarily a reduction of air pollution in very general terms. And more importantly, it is not necessarily an immediately observable reduction of the absolute levels of air pollutants right after the beginning of the lockdown. And the reasons why this is not necessarily true, they go back to the physicochemical complexities of air pollutants. Those emissions, if they get reduced, yes, you see rather immediate reduction of primary pollutants, traffic-related pollutants, like what you see in this slide, the nitrogen oxides from the exhaust. Yes, they have in absolute values immediately declined. However, many pollutants and many health relevant pollutants are also secondary pollutants. They are formed in the atmosphere in very complex processes. So if you look, for example, in Switzerland at the daily levels of ambient particles during this phase of the lockdowns, the ups and downs on a daily level of primary and secondary pollutants, they are not only explained by the emissions, but actually they are very heavily explained by weather factors. You look at the green side, this Lugano Università station is just downstairs of the building where I'm actually sitting now. You see this up and down is not determined just by the emissions. So what that means, indeed, by coincidence, in Switzerland, the lockdown was followed by a Sahara dust weather period where we have this typical increase in fine particles. And that has, of course, nothing to do with the lockdown itself. So the correct approach to estimate the contribution of the lockdown to air quality consists in the comparison of long time series monitoring data, including years in the past, prior to the lockdown itself, and the post-lockdown period, controlling at the same time for all the weather conditions and all the other causes of temporal variation of pollutants. And many studies have not done this, but just shown the absolute change, whereas the study I want to cite here of Venter, he has shown the reduction modeled on a global scale, actually on 35 countries. He has modeled the effect of the lockdown on various pollutants, and that confirms these complexities. So he has confirmed consistent reduction in the nitrogen dioxides, with one exception only, where it was more an upward trend. But if you look at the ozone, this is far more complex indeed. On average, ozone has even increased a little bit because ozone is usually reduced by the primary pollutants, traffic-related pollutants, and given their strong reduction, ozone has been profited, and actually we had fantastic weather in many parts of Europe, for example, during the lockdown. And you see the particles in general, they would also go down on average some 10 micrograms per cubic meter on this average of the 34 countries. But you see there is a lot of variation. So there is not a simple answer to this question, what is the impact of the lockdown? But of course, there was a reduction predictable, and this is important. So let me go now to the health issues. The first point is transition. Does ambient air pollution facilitate the spread of the virus? Some have argued that the virus itself is spread by ambient air pollutants, namely by particles. So viruses would adhere on an ambient particle, use these particles to travel longer distance and therefore spread more widely, given that ambient particles actually sustain for a rather long time in the air. So this scenario is rather scaring, as you can imagine. It would mean that more particles in the air, the more viruses you would find carrying those particles and reaching out to attack people over longer distance. So if you look at the size distribution of these particles, PM10 are smaller, are 10 micrometers in diameter, PM2.5 up to 2.5 micrometers, and you see the size of a virus. Yes, in theory, one could imagine that a virus is sitting on, is carried by these ambient particles. So the question is this a relevant and plausible hypothesis? If that was true, the spread would indeed be amplified in highly polluted regions. All that I can say today is that at this point, the hypothesis has not been confirmed, but it has been the subject of many really poorly done publications. It has been suggested, particularly in Italian media also, that the higher levels of PM contributed to the rapid transmission of the virus. According to this hypothesis, the exponential COVID-19 curve seen in northern Italy would have been flattened if particle concentrations in late February, early March had been lower. Particles remain in the air for much longer than the droplets, and it's distributed over much greater distance. So for the pandemic perspective, this theory makes a lot of assumptions, I have to say. First, it's assuming that the exhaled virus would effectively and in large enough quantities bind on particles. And this binding, it is assumed, would be larger in higher concentrations than in lower concentrations of ambient particles. The viruses on those particles are assumed to remain infectious, and the length of time that the virus remains in the air and remains infectious are truly prolonged as a result of all this. And that is, all these assumptions would need to be true to make this such a huge problem as some assume. Assuming that all other epidemiologically relevant factors remain constant during the pandemic, this would imply that in epidemic areas, more people are infected on days with higher particle pollution than on days with lower pollution levels. Yeah, let me show you. There is one thing to mention. SETI has done research to identify RNA of SARS viruses on ambient particles. And in fact, in a very recent paper, they have identified the RNA of the SARS virus on particles from Bergamo. But I want to emphasize also these authors, they do not claim that this is a proof of faster transmission due to air pollution. In fact, they make also an interesting idea whether monitoring RNA on particles could be used like as a marker of the recurrence of epidemic on a regular basis. So this is, of course, moving science, and there is no clarity about the meaning of these findings at this stage for the pandemic itself. But why is this theory so alive? In social media, heavily discussed, in fact. Well, because there are studies who claim this, although they are of inadequate quality. And you have maybe seen the funny slide I show here. It's a fun editorial from the Christmas edition of the New England Journal of Medicine a couple of years ago. The higher the per capita chocolate consumption in a country is, the higher is the density of Nobel Prize winners. Yes. That is just this correlation across aggregate data. And well, can we conclude from this that we should feed children with chocolate to make them Nobel Prize winners? I'm sure you would agree that this is not what actually Messerly even wanted to communicate. But let me tell you, In fact, this is the type of studies that got published from Italy, from China, to claim that the exponential transmission seen in China and thereafter in Italy was due to air pollution, simply because of this type of correlations between per capita number of cases and the city level of air pollution. So these are some examples of such publications. There are several more, and you see also reactions in the media on that. So you see, I'm rather skeptical in supporting this theory based on what we know. And actually, I want to emphasize this needs to be distinct by a very different and important debate, namely the question whether the transmission of exhaled viruses is exclusively based on droplet transmission, or whether those expired viruses could also form into smaller sized aerosols independent of air pollution. Yes, I do belong to the 273 scientists who have signed this paper of Lydia and Juni, calling for more cautious or less black and white interpretation of the aerosol transmission. Yes, viruses and also SARS virus may, under some conditions, indeed be spread through aerosols. So taking this possibility into account forces societies and engineers in particular to think about the relevance of, for example, ventilation systems, of air filters in buildings or in public transport, etc. So maybe this transmission is far less frequent than the droplet transmission, but to ignore the aerosol path would not help in preparing societies, particularly on the northern hemisphere, for the cold season that we soon will face, where people will stay a lot of time again indoors in closed and ventilated buildings. So let me move to the next level of the relevant hypothesis here. The defense, air pollution, does it affect the defense against a COVID infection? Let me first show this graph here with, for those who are less familiar with the health effects of air pollution, the list of established health effects of ambient air pollution is getting longer and longer every year. Also for today's discussion, it is important to keep in mind two dimensions of those effects, namely the short-term and the long-term health effects. So the short-term effects are those related to the short-term exposure, yesterday's level of pollution, the effect of today, etc. Whereas the long-term effects relate to our lifetime or exposure over many, many years. The pyramid in this slide shows you all the acute ailments that are caused and promoted by increases in air pollution on a daily basis. So what matters if a person gets a load of virus in the inhaled air is how the body is now able to defend itself against the virus in the short term as an acute reaction, and how this would be modified in the presence of air pollution. Does air pollution play a role? We do not know yet specifically for the SARS virus, for COVID-19. But we know since many years that increasing levels of pollution jeopardize the defense mechanisms in various ways, on various levels, on the level of the nose, the airways, and also on the systemic level, through inflammatory effects. It has been described, the disruption of the innate immune system. The macrophage function is changing, is jeopardized. The epithelial barrier disruption is known. They have all been described actually in animal models as well, if you expose them to particles. And it has also described in epidemiological studies, both in adults and in children. And let me show this paper of Nguyen Nguyen, a former Swiss TPH PhD student. She demonstrated this short-term association of the up and down of air pollution, for example, in Hanoi. On days with higher pollution, more children get hospitalized because of pneumonia. Air pollutants are a strong oxidant with systemic inflammatory effects, which also induces oxidative stress. And these pollutants, they do hamper the defense mechanisms. So it is a plausible hypothesis that pollutants also increase the susceptibility to SARS per se. In fact, if you go to the literature, you would find the study of Croft from New York with 500,000 of adults. They looked into the hospitalization patterns in dependence of air pollutants. And as you see in this graph, the association is shown for culture negative pneumonia, thus possibly viral pneumonia. Of course, this is not COVID, but other viruses. And the results actually were very similar for influenza. As you see, on average, some 1 to 2, 3% increase per 7 micrograms per cubic meter of fine particles in the air on a daily level. So why did our commission not agree with the proposal to call for clean air emergency measures in Switzerland in mid-March? Well, the lockdown, as shown, implemented already very extreme measures that reduced air pollution. The effect of additional measures, if you would even find additional measures, the effect on air quality would be very, very small. Second, one should put the size of those effects of air pollution into the context of the dynamic of the pandemic per se. You all know these exponential curves. So let's take the observed global reduction in PM 2.5 as a benchmark, a reduction of 10 micrometer per cubic meter. What does that mean? Let's assume emergency policies reduce particles by 10 micrograms per cubic meter. So daily hospital admissions due to pneumonia or due to myocardial infarction as well, they would decrease by some 0.5%, maybe according to the Croft study, maybe 2 or 3%. So that is about the size. And this increase does not put the healthcare system into jeopardy. Those numbers need to be put into the perspective of the exponential growth of hospitalizations in the absence of physical distancing and other well-known measures to abate the pandemic. So in the early phase of the pandemic, hospital admissions increased 30 to 60 and even more % every day due to COVID, doubling of cases every 3 to 4 days. So to call for emergency clean air strategies at the onset of the SARS epidemic is a little bit like calling for a glass of water to abate the current Californian wildfires instead of assembling the firefighters of the entire Western states of the United States. So to bring the healthcare system to the edge with air pollution, yes, this is also possible, but there you would need very, very extreme smog episodes, episodes that we don't see these days currently, not even in China or other places in Asia or in Africa. So you would have to go back to situations observed in the 1940s and the 50s in Europe, like the London smoke, which was much worse than what we see in Wuhan or in the Lombardy. So, but what matters if a virus spreads, and that's the next level, is actually the health status of the population. So long-term exposure to air pollution, and this is now a long-term question and not yesterday's pollution, long-term exposure does indeed affect the health status of populations. So again, this is the list: long-term, lifetime exposure, cause chronic ailments such as lung cancer, respiratory diseases, most importantly atherosclerosis, which is the underlying disease of so many heart diseases, cardiovascular diseases. More recent evidence also from the famous Swiss Sapaldia study, which is led in Basel by the Swiss Tropical and Public Health Institute, supports the hypothesis that air pollution also causes or enhances the development of diabetes. So the health thesis, the third one and the fifth one of my talk, the aspects that we are focusing on, they both relate to those domains of long-term effects. And let me show now from the global burden of disease, the estimates of the attribution of air pollution to the total number of deaths due to these causes of death. So you see 20% of COPD are currently explained by air pollution. 11% of deaths due to heart diseases are explained by air pollution. 14% of lung cancer, 13% of diabetes. So with this in mind, it is reasonable to conclude that regions who suffer from high air pollution since many years do have more people with these diseases. And as you obviously see, it turned out that these diseases are the so-called risk group diseases for COVID. So how much this very plausible link contributes to the ongoing pandemic and its dynamic is not fully known and subject to ongoing research. For example, there was one analysis done in China, and Yao concluded that the COVID-related case fatality rate increased by about 0.2% for a change in the long-term average particle concentration of 10 micrograms per cubic meter. So they tried to take into account some factors that also affect the case fatality rate, which is a measure, as you know, to be interpreted with caution anyway in this pandemic, given the difficulty to get good data in the right time. An early preprint publication from Francesca's Domenici's group from Harvard, they claimed this to be true also in the US, but as you see, they observed in the corrected version actually of their paper, namely they observed 150% increase per 10 micrograms per cubic meter in the estimate of COVID-19 deaths. So needless to say, if you look in such studies, there is need for more careful look into this. It is very difficult to interpret such hugely diversing studies. Indeed, the same group from Harvard, they have just published 5 days ago, a review on currently published data about the effect of air pollution on COVID. And as you see, they found 28 publications, and they themselves caution because 27 of these 28 use rather questionable designs. So this discussion, the quantification of the problem of air pollution in the COVID pandemic is not finished. However, what does that still mean? It is still a strong reminder to all governments of the world that clean air policies do matter, not only for the air pollution related diseases per se, but in more general sense to support health of the people. Policymakers must adopt very strong and rigorous clean air policies, and they must set science-based air quality standards as proposed by the WHO. I showed just a few examples of where we stay with national particle standards around the world. Only very few countries follow the WHO air quality guidelines. And COVID just shows once again that it is wrong to let political agendas determine the clean air policies, such as in the European Union, where the Commission refuses since 20 years to adopt a science-based particle standard. Yes, had the European Union adopted those standards, also in Italy, in Belgium, with more ambitious clean air policies, those hotspots of pollution would have had better air quality also in this year, all through the past years, and therefore less people in the high risk groups for severe COVID. Again, air pollution cannot explain the exponential growth per se. It is though an example for the need to consider health in all domains, also not only during pandemic periods. There is no natural reason why northern Italy remains a hotspot of pollution other than policy making. There is no reason why Los Angeles has become far less polluted than northern Italy over the last 30 years, other than the willingness of the Californian authorities to adopt very smart and rigid and clear policies. So some fraction, although it might not be a large one, of the COVID burden is certainly related to insufficient clean air policy making in the past 30 years. Given that we are in Lugano with the Lugano Summer School, let me show what a more rigorous, a more ambitious and science-based clean air policy agenda was able to achieve in Switzerland, in the middle of Europe, And right at the border, in fact, to Lombardy, you see one line is in fact the Lugano, the green line is Lugano on this slide. All federal monitors in Switzerland, they now comply with the science-based WHO air quality guideline levels, which are indeed the ones we have put in the Swiss regulations. And this is a very remarkable success, given that Switzerland is not only small, very small, but located in the middle of Europe. And of course, air quality of small countries also depends on the clean air policies of the neighbors. So even here in Lugano, with its record of being the most polluted region in Switzerland, due to the close proximity to the northern Italian Lombardia area with its high pollution, these policy goals have been reached over the last 20 to 30 years. So the very low levels of air pollution now prevailing in Switzerland are also a main reason that our COVID report to the federal government concludes, from a purely Swiss perspective, that the link between long-term exposure and the burden of severe COVID cases cannot be a major issue anymore in Switzerland. Of course, such a quantitative statement downplaying, let's to say, this does not apply one-to-one to other more polluted regions like the Lombardia or in Asian or African megacities. So COVID should be a strong reminder that ambitious investments in long-term clean air policies do matter, and that one can indeed make a huge difference. So the other two remaining health aspects, number 5 and 6, they both relate to those who already suffer from COVID-19. So the first hypothesis is placed in the short-term effect domain. It postulates that air pollution has an influence on the progression and therefore the severity among truly ill COVID-19 patients. So given what we know about the pathophysiologic mechanisms of the acute effects of air pollution, the hypothesis is rather plausible. In fact, it is not even strictly distinct from the first aspect, namely the incidence of COVID-19 under higher air pollution, because it is of course a continuum between exposure to the virus and all the preclinical and the clinical stages of an infection and the disease and its cure. However, there are still different mechanisms involved along the path of a disease. So the distinction is relevant. In many countries, COVID patients would actually access the healthcare system in search of support and treatments to deal with the severe symptoms and the side effects of the SARS virus infection. Does air pollution matter during this phase of the disease? Does air pollution jeopardize the effects of treatments or keep the patients for longer in severe conditions? There is no study, to my knowledge at least, looking at the effect of air pollution on the success in the management of COVID-19 patients. I think those studies still need to be done. However, the literature provides some very interesting information about how air quality may matter in the treatment phase of diseases. The graph shows you an example where it has been shown that ambient traffic-related pollution affected the mortality, the survival of lung cancer patient treatment in California. It's a very big study, some 20,000 patients. Another study shows that air pollution jeopardizes the treatment success in case of non-cardiovascular diseases among patients with heart disease. And a third study I would like to mention shows that the survival under regular tuberculostatic therapy was better in Californian patients of tuberculosis, the lower the ambient level of air pollution was. Again, these examples are not about COVID-19 per se, but let's put it that way. I would say in case COVID-19 patients would have a choice where to be during the treatment, I would go for a no-regret cure in a less polluted area rather than in a hotspot of air pollution. Indeed. Well, this is an interesting historic reminder about where we stood 100 years ago. The Spanish flu coincided still with the tuberculosis epidemics in Europe. And one business model, without much scientific evidence at that time indeed, was to bring the wealthy patients to the Magic Mountain clinics into the clean air in the Alps. It looks like not a bad idea given what we know today about air pollution and its health effects. Again, in regions with low pollution, this issue cannot be utterly relevant in the pandemic, like here in Switzerland. Today, in regions where healthcare facilities are air conditioned and actually equipped with air filters, this is also not too much of a relevant avenue, given that such facilities would usually have much lower levels of ambient air pollution than what you measure outside because of the ventilation system filtering many air pollutants. So let me go to the last pass. It's again a long-term effect hypothesis. As you may know, it is rather unknown what it means to have gone through a SARS infection. It is not only unclear how immunity develops, but there are studies emerging indicating that the virus might induce unexpected systemic pathologies, long-term chronic diseases, inflammatory in nature or immunologic diseases, possibly affecting the cardiovascular or the neurosystem. So this is really not known at this stage and far from clear. But one can hypothesize that those long-term secondary effects of the SARS infections could be modified by exposure to ambient air pollution. And to investigate these interesting hypotheses, we will need very large multi-center cohorts of COVID-19 patients in collaborations, actually international collaborations, to have a very widespread diversity in air pollution. However, we must remind policymakers anyway that air pollution has huge implications on public health. And this calls for sustained long-term policy actions that keep air clean anytime and everywhere. In fact, we have many examples throughout the world showing that this is possible and indeed economically very sound, as it is far cheaper to keep the air clean than to deal with the enormous health consequences of air pollution. Clean air fosters the resilience of the population, also during the health threats such as COVID-19. Regions with cleaner air have fewer people who suffer the so-called risk disease for severe COVID. So the pandemic does not provide an argument that we need lockdowns to improve air quality. What is needed instead is the adoption of rigorous clean air policies. In strong contrast to lockdowns, clean air policies do not negatively affect the economy, but indeed clean air is part of a sustainable and prosperous economy. And this was true prior to pandemic, and it remains true also in the future. We need to call for globalized leadership in the adoption of clean air policies to reach the science-based WHO air quality guideline values. Thank you very much for your attention.
Thank you very much, Professor Kuenzli, for this insightful presentation and showing us the links between air pollution and COVID. I'd like to open the discussion now, and so if the audience has questions, please type them in the Q&A section, and we will then read it out to Professor Kuenzli. And to give you some time again and to type, let me start with the first one. What do you think, Professor Kuenzli, does the COVID pandemic help the advocacy work to have governments installing measures to reduce air pollution? And if so, why yes, or why you're rather hesitant that it will facilitate that work?
Well, it's a good question and hard to predict where it goes. As you do know, COVID has triggered all kinds of constituencies to defend and move up with their old agendas, which of course are still here. I mean, COVID is just one thing in terms of health. We have all these other problems, air pollution and climate change and everything. It is hard to predict how actually the politicians will pick up on these, let's say, old duties that have not disappeared. But somehow what I do think is people through COVID have also learned to work together in different ways. So in some way, I'm optimistic that movements, also grassroots action to enforce and to call for clean air policies might actually be better heard in the future. But actually, what I'm concerned, we should not defend the call for clean air with COVID per se. So we should not use scientifically wrong arguments to call for something we know since many years we should do, and that is clean air policy making.
Okay, thank you very much. Let me hand over to Tammy for bringing in the questions which came through the Q&A section.
Thank you very much, Marlene. Thank you. Prof, I have a question here for you from Salaru. He's asking, in your opinion, should air pollution reduction policy become part of non-communicable disease policies, saying that air pollution is reported as the 5th risk factor?
Oh yes, Tammy, I totally agree. And actually, if you look a bit on what people do since many years, what WHO does, of course, the one reason why air pollution is very high up on the policy agenda, it is exactly related to the NCD, because as you have seen the list I have shown, NCDs are a major outcome of long-term exposure to air pollution. So this is a very important point. Yeah.
We're waiting for more questions.
I see one. Tammy, you see Adrian Wahl?
Oh, I see.
All
right. Andrian asked, with regards to clinical air quality, what would be your best guess for which causality hypothesis researchers should base their investigation on in order to improve healthcare worker safety?
That is a very tough question. So with regard to clinical air quality, so you mean in the place where health workers work, what would be your best guess for on which causality hypothesis researchers should base their investigation in order to improve healthcare worker safety? This is a tough question. I think related to my field, I'm just advocating again the need to look carefully in ventilation, air conditioning systems, how they are maintained, whether filters are well maintained. I think that because there is this problem of possible aerosol transmission, particularly in the healthcare setting. Else, I think those who really work in the healthcare would know better what are the major challenges in dealing with the issues of the healthcare worker. Of course, apart from the stress, I think we should make sure they are not overworked, they can still have their free time, etc. So this is a very important domain, occupational health domain.
I have another question here from Mike. He's asking, where is the place of face mask in the link between COVID-19 and air pollution? Can we say wearing the mask helps to prevent COVID-19 and also air pollution?
Yeah, this is a very good question, actually interesting. Particularly from a European perspective, as you know, we had a hard time, particularly in Switzerland, to accept the notion to have masks on. But for those who, like us, who traveled around the world, we know that in highly air polluted areas, people wear masks since many years on a daily basis to just get less exposure to air pollutants on their commute. And in fact, there have been done some studies in China, nice work done already at the time of the Olympics in Beijing and later on, where they looked into the efficacy of face masks. And of course, there are differences depending on the quality of the mask, but it's similar to the COVID story. Having a mask is certainly better than not carrying a mask. And depending on the quality of the mask, you may protect yourself a little bit more or a little bit less.
Thank you, Prof. Rebecca wants to know if you've reached out to the 150 researchers who signed on the article about air pollution contributing to the spread of COVID-19.
Well, this community has been reached I mean, this community, many of those work since a long time together also with WHO. So I have been approached of the leaders who were working on that, and many others just received it through the same, I mean, through existing collaborations. And we have signed that, co-signed it, because there was a period where particularly also people in the medical field have very strictly divided the notion of transmission through droplets versus aerosols, and dividing these two worlds as if there were just two worlds and nothing in between. And that has to some extent come with the risk that people would not address the issues that could be related to the aerosol transmission. And that was important to break up a little bit this black and white notion. Yeah, I'm not saying we would know at this time which of the transmissions is more relevant. I think in the daily life of the pandemic, the droplet transmission has been and remains to be a very, very important path, but we don't know exactly the role of aerosol transmission. And actually some have argued that maybe the aerosol transmission might be rare, but it might happen exactly in those cases where a few people spread very, very highly to many, many other peoples, the so-called super spreader phenomenon. And if that is true, that's another reason to, of course, not look away from this idea and the problems around aerosols and take care and finding solutions.
Lucia has a question here. She says, what would be the burning question related to air pollution and COVID-19 that you would prioritize considering most promising to be answered as soon as possible?
Well, this is forcing me to tell you whether we should do research there. I mean, of course, people do research anyway. You have seen the 28 studies and many others will come. I think from a purely research perspective, what I would like to see are really well done studies addressing the hypotheses that I have just gone through. And with that, I really mean large person-based, individual-based research, yeah, and not just this type of aggregate correlations. And I'm looking forward to see those, and I could imagine that some of these hypotheses will be confirmed. But my impression is still remaining strong that from a quantitative perspective, I don't think that air pollution plays a dominant role in the crisis of the pandemic. So what that means, it means from an air pollution perspective to go back to what we do since 20 years. We are since 20 years telling people, policymakers, agencies to focus on long-term solutions to abate air pollution rather than go into this frenzy emergency mode, ignoring air pollution all through the year, but then make big fuss out of a short period of a smog. So this is similar to the pandemic, where we should not just focus on the very short beginning, but on the bigger picture of such a public health challenge and threat. And that's the same is true for air pollution. There, of course, the answer is not even to do much more research, but to act. Actually, we need research to figure out why so many agencies, ministers of environment and of health don't take action. Why can we be so reluctant on a global scale to not take action? And you don't have to go only to Asia, but you can, as I mentioned, even in Europe, European Union has a record of very bizarre, some very bizarre decisions in air quality management. So why is this happening? This is purely political. It's driven by interests, and these interests are not the interests of people and of people's health. And we should focus on that, honestly.
So there's another question here from Louise, Prof. She's asking, in this case, do you think living in rural areas is safer than living in urban areas where people are exposed to more pollutants due to factories and cars?
Well, I heard the statistics in Switzerland, at least, more and more people have now decided to move to more rural areas. And of course, these are complex decisions. It's also the idea to move out of crowded areas, which from a COVID perspective makes a lot of sense. In terms of air pollution, of course, in many regions, not all over, but in many regions in the world, rural areas still have somewhat lower pollution, but differences are not huge, and actually we should pay attention. Our individual solutions should not add to the problem. We have seen that in European countries in the last 30 years, people moving out of cities and then driving with dirty cars into the city. That doesn't really help air quality, neither in the city nor in the rural areas, because ultimately air pollution is shared across larger regions. But from a personal perspective, of course, it matters where you live. I mean, if you have children, if you have the choice, I would not live directly adjacent to a very busy road, but rather look for an apartment somewhere in a more rural area, or somewhere on the second or third street, rather than at the busy road.
Alexandra is asking, isn't there a risk if we focus on aerosol transmission when we don't even have enough resources and measures to address droplet transmission?
Well, of course, there is a difficulty in making the right decisions and prioritize. But honestly, fortunately, some of the key policies we need to enforce because of the pandemic, they work no matter how the transmission is. And in fact, one major argument one publication actually also makes to argue that maybe the aerosol transmission is not highly relevant is in fact the observation that these simple rules in dealing with COVID, such as physical distancing and hygiene and all the others, you know, they were extremely effective in all countries. So yes, maybe there is an additional dimension with the aerosol transmission, but I think we should not move resources and policy away from what we would do anyway, no matter what this transmission really is. The problem with the aerosol transmission is really more related to this former notion that this is completely not existing. And that is a bit a risky view. And I'm not saying we should now move all resources into that research on that transmission or into the policy that only relate to those transmission. But we must be open to continue doing the right things to stop at least, or to flatten the curve or keep it low as possible.
Thank you very much.
I think
that's all the questions.
I'm just on my phone. I'm still watching the plenary.
Some time for more questions. So if you have any, please feel free to type in the Q&A section. Maybe I use the opportunity to ask you, Professor Kuenzli, something which is troubling me since the beginning of this crisis. It does link to air pollution, but not exclusively. Why is it so much harder to get policymakers and people moving and accepting measures which address long-term issues, and why we are so ready to react to acute dangers, let's put it that way?
Well, good question. I would assume maybe the social scientists have far better answers than we do have, but this is of course, this is an important observation. I think one element are the media. It's very attractive if you talk about air pollution. I mean, it's a wonderful topic in the first page of a newspaper to talk about very high pollution. Yeah, so you can make these stories rather than talking every day on lower air pollution. But in fact, this lower air pollution from a public health perspective is far more important than the few peaks. Yeah, so and this is just not attractive, attracting the media. And then politicians, the politics, of course, have a little bit the same attitude toward short term in general, because with short term action, you might do something to get re-elected, whereas if I'm fighting today that air pollution is better 20 years from now, like climate change is better 100 years from now, that is a bit a hard sell for people who have a 4-year term. And I mean, if you remember the slide I showed on the decline of air pollution in Switzerland and in Europe, Eastern and Western Europe, of course, it takes a lot of time. Yeah, I mean, this is not just happening immediately. If you look at a reduction of 10 micrograms per cubic meter of particles, which is what the lockdown has more or less on average maybe caused on a global scale. If you want to reach that goal, that the annual mean comes down by only 10 micrograms per cubic meter, if you look at these graphs, this was policy making success across some 5 to 10 and in some countries even 15 years. So for a politician, you need a long-term vision to support such things. And of course, the public, I think the grassroots, the movements, the pressure from the public is very important. If a majority believes it is important to invest in the future, rather in the long-term future, rather than just in tomorrow, things happen. And of course, what you see in all the Western countries, that is the story of the last 30 years. Things have improved, just in different speed, yeah, so to say. And this did happen, and it was very much pushed and pressured by the people. Yeah, by movements, by green movements and others. Yeah.
Okay, so an encouraging perspective of that every opinion matters, and at the end it's the sum of the opinions which can also make changes.
Absolutely. Yeah.
I think there is one more question which came in.
Yes, the question here is from Marlo. She's asking, in indoor areas, could air pollutants, for example, CO2 and PM2.5, serve as markers of the need to ventilate? They are certainly easier to measure than aerosolized virus loads.
Hi, Marlo. It's great to hear or read you on the screen. Well, that is a very good question. Yes, the question of the marker indoors. I think, I mean, you're right. Of course, measuring pollutants indoor is far easier. Actually, the point you make for CO2, I think this is indeed a very interesting, very cheap marker to understand the air quality. Of course, it is a marker, CO2 per se, as you know, and the others is per se not a health issue, but it is a marker of the freshness, the cleanness, the ventilatedness of the indoor air. And this has been used actually in many occupational settings and others. And I think that is an excellent comment you make, and it could be something that would help, let's say, bigger companies that have all these large facilities where people work to understand and monitor a bit how air quality is and how the ventilation works, windows opening and other things which become actually more difficult in winter times. Yeah, so this is a very good idea. Measuring particles that you also referred to, that is, as you know, it's a bit more trickier to do that well, more expensive, but definitely CO2 would be a very interesting idea. Yeah, thank you.
Okay, so I think with this we close. There are no more questions, and thanks everybody for the lively discussion, and particularly to you, Professor Kuenzli, for the very insightful presentation.
It was a pleasure. Thank you.